Hello and welcome everyone to this webinar. I'm Francis Seeley from GlobalNet 21, and this is one of the many webinars we do on a number of issues that affect us all in the 21st century. And this is one of the ones we're doing in the morning, and it's a very special one because we've been working with Andy, Miah and Emma Rich, who you'll see in a minute, who have a really exciting and interesting project that looks at how digital health is impacting on young people, how it affects their behavior, what are the consequences for health in the future, for the health service, and so on. And we've already done a webinar on this where we've looked at some of those issues in a broad brush way. And in this webinar, we're going to look at apps, particularly what apps are being used, what apps are planned, and what the impact on the health service is. And again, you'll see Hazel Jones, who we got with us, who's from NHS Digital, so she's the exact right person to talk about that. Incidentally, we also are going to have in April a House Commons meeting on this, and for those of you who've come on this webinar, we've got your details, so we'll send you information about that in case you'd like to attend it, and I hope you will. Anyhow, what we're going to do first is Emma Rich, who is from the University of Bath and works with Andy in a project. She's going to give us an overview. Then Andy Miah is going to talk for about 10 minutes to Hazel about NHS Health and the apps that are being developed. Then Emma's going to come back and give us a very, very short presentation. And then we're going to open it up to you and we'll put your questions directly to them. So please type it in. I think we've got Peter Feltham on here who often comes on and he'll help you if you have any technical problems. Type it in, he'll answer it for you. And that's always a useful thing to have. So thank you, Peter, for doing that. Anyhow, Emma, thank you. Well, thank you all for coming on. But Emma, over to you to start it.
Thank you, Francis, and thank you everybody for joining us today. We're particularly, Andy and I are particularly excited to welcome you here, Hazel. Thank you for finding the time to participate in the webinar today. We're really excited to hear about some of the developments within the NHS in terms of the apps and wearable programme, and really timely, I think, in terms of how young people are engaging with some of those technologies. So in the first webinar, this is the second, in the first one we spent some time just going over the project and sharing some initial findings, some challenges that young people are facing in terms of their digital health use. So if I can, I'm just going to spend a few minutes just going over our research project, talk about some of the aims, and then I'll hand over to Andy and you, and we'll explore some of those themes in detail. So just by way of background, so this is a project that's been funded by the Wellcome Trust, and obviously myself and Andy participating in the webinar today, but we also have Sarah Lewis, Dr. Sarah Lewis joining us. She's part of the project team, and I think she's viewing and maybe posting some questions today, but also Professor Deborah Lupton at the University of Canberra in Australia, who writes extensively actually around issues of digital health, and writes a really interesting blog around some of these issues. So worth visiting. Those of you that are online today might want to have a look at that. So essentially the project is about understanding how young people are engaging with apps, with wearable technology, with social media, and trying to get a better sense of what they're learning, how they're accessing and negotiating and making choices around what they see as kind of safe, reliable and helpful forms of technology. And we're particularly interested in the kind of healthy lifestyle technologies, if you like. So not so much the kind of medical diagnostics, but those that young people are using in their everyday lives to learn about being healthy and to sort of participate in online forums, use technologies for tracking, sharing info, looking online in terms of images around health and fitness, but using all those technologies combined to kind of learn about being healthy. So the project is really interested in looking at those technologies and then thinking through what are the implications of that in terms of both their identities, but also their actual health practices. So in terms of what we're doing, This is the kind of story so far in terms of our methods, and thanks to both the Wellcome Trust for funding this, but also all the young people and schools that are participating in the project. So we've just undertaken a large-scale survey where over 1,000 young people aged 11 to 18-year-olds, and primarily the aim of that survey was to get a better sense of some of the milestones. So at what point are young people using different types of technology? What are they using them for? What kinds of health messages are they receiving? And how are they using data and information in the context of their wider lives? So part of that is trying to understand some of the challenges around interpreting data, what they see as safe and reliable, but also how they actually put that into context in terms of how they then make changes, choices around their health behaviours. The second phase is then some interviews and focus groups with young people, where we're trying to get a bit more depth and understanding around those complexities and some of the challenges. And then finally, I think one of the interesting things around apps is certainly young people are telling us at the moment they use them for so long, and then they want to try a different app or move on to another technology. So in the final phase, what we're actually doing is using what we call a live or real-time methodology, where for 6 weeks we're working with a small number of families, and they're going to try out some of those recommended apps and try some of those wearable sort of Fitbits and so on, wearable technologies. And we're going to be speaking to them in real time and asking them about their experiences as they actually use those technologies. So how do they feel, what's helpful, what puts them off using them, and how does that kind of sit within the wider context of their family life, their friends, school life, sport, physical activity? What are the things that shape their experiences of using those technologies? So a fairly, we think, innovative and different way of trying to understand users' experiences. And we've just put that stat up there from our survey, but we thought that would be an interesting starting point for our conversation, that 75% of young people own their first mobile or tablet and are online between the ages of 8 to 11. So certainly sort of getting online and starting to look at health information at quite a young age. And in terms of some of the sort of key findings, we'll look at towards the end of after the conversation between you and Andy, Hazel, we'll look at some of the more detailed comments from some of the young people. But just some key findings. So 55% of from the 1,000 of people, the young people that we've spoken to through the survey, are using their mobile phone for health. 52% are using sort of self-tracking apps around fitness, health and diet. Instagram and Snapchat were their favorite social media platforms for finding out about health. So a lot of them are using images, sharing or looking for hashtags around certain health themes. YouTube was reported as the top site to help young people understand health better. So that was really seen as a go-to source of information. But one of the biggest challenges that they've reported is actually how do they make sense of all the information out there? How do they know what's reliable? So we have actually spoken to them about how useful having this set of recommended apps is for them, because one of the challenges that they face is sort of wading through all that information that's online and trying to make sense of what's helpful, what's reliable and meaningful to them. Alongside that, they've also expressed concerns about too many apps out there and you know, the sort of thousands, hundreds of thousands of apps that are available in the App Store. So those are just some key things as a starting point that we might want to explore. And as I say, I'll come back later and share some of the more detailed comments from some of the young people. So I'll hand over to Andy now.
Welcome to you, Hazel. We're really glad to have you here, not least because we'd scheduled this webinar and then saw the call out from the NHS to enrich its apps library. And so it just felt like perfect timing to have seen this and found you on Twitter. So it's great to have you here. And I suppose we wanted to get a bit of a sense of what you're up to. You have this fantastic title, Program Director at Apps and Wearables, which I note includes uptake. And I guess uptake's really crucial. Having looked at some of the apps already in the library, it'd be great to get a sense of what you're hoping to do over this call out. And is it an ongoing call out and there's a deadline for it? Is it just generally trying to get people to develop for the library? If you could tell us a bit about what you're doing, that'd be really great.
Yeah. Okay, so I joined NHS Digital about 10 months ago, and at that point we'd launched a beta version of the apps library, and that was literally a beta to test out multiple kind of concepts. But I think what we haven't done at that point is thought about the strategy and who are the needs that we're trying to address. To do that, we need to understand that, okay, if there's already a marketplace of over 250,000 apps, but we know that they're not checked for clinical effectiveness or clinical safety, then what's the value that we can add as NHS Digital? And then we looked at the other three groups. So there's already patients and citizens, as you've said, that are electing to use the apps that are already available via the App Store. But we found the same thing, which is that A, there's too much choice almost, and B, there's still no kind of evidence base to say that these apps have gone through any kind of clinical safety or clinical effectiveness type selection. And then from a health practitioner perspective, so they're already recommending apps in some cases. So things like smoking cessation apps are already things that are recommended as part of that. But if we were going to look at it more broadly, it's what do we need to provide out there for healthcare and social care professionals, give them the comfort to be able to know which apps are actually going to lead to better health outcomes. And then the fourth group, which was the call out, is around the developer marketplace. So the fact that the market's already spoken in the fact that there are 250,000 apps out there that people are engaging with, that need's already kind of been established. But I think what's notoriously difficult is to understand how to engage with the NHS, to take something from being a concept right through to where it's actually being used, so from an uptake perspective. So I spent the first couple of months really thinking about, okay, what is it, where can we add value then? So we don't want to stop innovation. There's loads of stuff going on from an innovation perspective. And we absolutely don't want to stifle anything that's happening, but how can we leverage it? And so we thought, well, the value that we can bring is from the NHS is our brand, and putting together that framework that helps us to understand what a good app looks like. So using our clinical expertise to assess apps, and also to assess kind of any kind of efficacy that's purported by that app, and to look at the evidence base around that, so that we can kind of prioritise those ones that have got the biggest impact to get through that process. But what we did, I think, during the beta is we took a selection of different apps across different health themes to try and test our thinking around that framework that we need to put together. So I think we've now put the framework together. We've been testing it with different app types. So we've got apps like connected apps, so things like Evergreen, Diamec, Echo, that all offer kind of digital transactional type services. So not necessarily kind of healthcare advice as such, or clinical advice, but more transactional. Help me book a GP appointment online, help me order a repeat prescription online. So those are the kind of connected apps. And then we've got other apps that things like Brush DJ, that play a couple of minutes of music so that you know to brush your teeth for 2 minutes, that are kind of lower risk apps. And then we've got the whole piece around apps that provide AI type functionality and offer kind of more directed action to the users. So we've come up with basically a framework that means that we can take apps through an assessment that's proportionate to what they do, and leverage existing assurance processes within NHS Digital. So where an app such as Evergreen or Diamec or Echo have already been through an assurance group within another part of NHS Digital, rather than reinvent the wheel, let's just pull those apps in, because we know they've been through a hefty level of assurance. So that first bit was about that framework and working across the different regulators. So MHRA, that are responsible for medical devices, CQC, that obviously go out and carry out assessments about the level of service provided, and NICE, obviously, who look at indicators of effectiveness and efficacy of apps. So over the next few months, we've just actually, and it'll be ready by the end of this week, finished testing the current question set with developers. And that's been in quite a rudimentary form. So because we were in a beta process, it's been a lot very much paper driven. So in the background, we've been creating a digital mechanism to enable us to guide app developers through that assessment process. So we're looking to launch a renewed version of that in July, and then we will continue to co-design with developers and continue to iterate that, so that becomes more of a repository where developers can go and say, well, how do I know if my app's a medical device, and where we can try and take all the learning that we've developed and put it in a useful context that's easy to use, so that developers can kind of self-serve through that process. In parallel to that, we've actually been carrying out our own user research over the last few weeks around the apps library. So again, I think the apps library started off as a repository, but we were all cognizant of the fact that that's not a natural kind of place to showcase apps and wearables and other digital tools. That actually what we need to do is understand that when somebody's got a need, what action is it that they take to be able to find information relating to their need, and how can we surface those trusted apps in those journeys? So and this is why this is very timely actually that we're engaging in this way, because our user researcher that's hopefully on this call as well, this webinar with us, is working across different groups, healthcare professionals, patients, citizens, developers, to understand the kind of the fuller piece, so that then we can put together a strategy that helps us deliver in the right way and at the right journey points. So things like you said about YouTube, you know, how do we factor that learning in to our strategy of how we start to surface digital tools? So there's that piece that we've already have NHS UK, NHS Choices, conditions pages that we get millions of visits to, where people go to find out more information about conditions. And we're looking at the moment at the top kind of 5 healthcare themes that were called out in the 5-year forward view, which is available if you Google, that maps out the kind of trajectory that was talked about of kind of exploiting digital technology more to help people achieve better health outcomes through self-management, and give them more choice in terms of how they want to engage with the healthcare sector. So that's a piece of work that's going on now. We'll be looking, so what we'll probably end up doing is we'll still always have this apps library piece as a repository, but what we'll also deploy is the surfacing of apps within those user journeys. And what we'll also look to do is work with Apple, so that we can set up an NHS kind of collection within the App Store, so that there's clearer signposting to apps that have been through that testing. And the other thing we found while we were going through beta testing is that obviously NHS are known for being quite risk averse, and as part of that, it means that the app's assessment takes quite a while for us to get through, and that means that it limits our ability to offer more choice. So as part of this program, we're also launching an approved assessor framework. So again, we can leverage external assessors that are already assessing apps for their own kind of libraries, and we're going to look to bring them in, so that we'll create alignment around our assessment, which we call the digital assessment questionnaire, so that any approved assessor that signs up to commit to assess against those standards that we've defined will be given a stamp of approval, so that any commissioner, sponsor can go to them, or even an app developer, to say, please assess my app against these standards, so that we can be part of this NHS collection. So we've onboarded one of those suppliers at the moment to work with us on elaborating that out, and then we'll hopefully scale that and kind of targeting 5 of those assessors by October, which means that then you should start to see a much wider choice of apps available via the apps library and in the NHS UK journeys.
And so in terms of how that trickles down to the user experience and how they make decisions about, I guess, which apps they use, would you envisage then some kind of rating or quality assurance value that's visibly sort of there?
Well, so at the moment, it's a funny world, the NHS, because you can't underestimate the importance of a kind of an NHS opinion and how that impacts developers that might have one score as opposed to another. And so our view is that any app, so what we want to do is not have one app, a one size fits all for anything. What we want to do is leverage, because as you found probably with your research, different demographics and different users will want a different user experience anyway. It's unlikely that one app is going to make everybody happy across a specific kind of capability. So rather than try and stifle too much, we'd rather create choice and let the user choose which app from a selection of apps that better suits them, and that kind of plays into this whole nuance around apps, which is that people don't tend to download them and use them for 5 years. It's not like other forms of technology. People like to dip in and dip out, and they become, people are looking for the latest and greatest. So part of the strategy of leveraging market innovation is that competitiveness within the app vendors will mean that we're constantly evolving and getting the best versions of apps. So what we will do is just surface the apps that meet our standard, and let the user decide which out of a selection of apps better suits their need.
Mm-hmm. Well, I'm conscious of time. It's over 20 past now, so we're going to have another 40 minutes, I think, before we sign off. And I think at this point we can welcome people to come into the conversation, but we can keep talking whilst that's happening. I guess one of the things that strikes me is that this potentially is a huge program of work around what you're doing. And are you looking at trying to develop a bigger research framework around what the NHS is doing here? What is sort of 5-year plan for your role and how that grows? Because it sounds like it could be huge.
Well, it's funny you say that, because so I'm new to public sector. I'm from a private sector background, and it was a massive learning curve. And actually, if anybody, one of the things I found really useful, if there's anybody that's listening that wants to understand how the NHS works, the King's Fund have made a fantastic video. Actually, it's only a couple of minutes long, so you can Google King's Fund, how the NHS works, and it'll explain all the different organisations. But that was a piece for me to get my head around. And what I absolutely didn't want to do was to come in and reinvent the wheel and start to step on the toes of people that are better placed than us to know about research and that kind of thing. So rather than the programme setting up its own kind of research group, what we want to do is partner with and leverage the groups that are already going on out there. So from an uptake perspective, I came across the AHSNs, which is the Academic Health Science Networks, and they've been specifically commissioned at a regional level to help take innovation from the marketplace, digital innovation, and help developers navigate their way through into pathways care. So what we're doing what we're trying to do is make the whole ecosystem kind of linked together, and use that developer front end piece to start to signpost developers through that journey. So they may come into us through our current online kind of developer portal, or they may come through a commissioner that's saying, look, I've got a health need around maternity, so I want to get these apps assessed to see which of them meet our need, and so that we can start using them. Or they may come through the NHS England commissioning route, which is the route that we're currently engaging with at the moment. And so we'll take them through the assessment to give them the kind of seal of approval to say, yeah, you meet our need, and we'll manage that app life cycle kind of process so that anytime there's new releases, we're staying on top of that. But then we will start to direct app developers via the innovation hubs to things like the innovation technology tariff, so they've got a route through to say, right, okay, now I've got the stamp of approval, how can I go out and get commissioned and start getting paid for my app? And things like that. So we won't reinvent the wheel on that. We will just align and collaborate with those existing entities that sit there already, that are already operating, but just collaborate to bring that together and communicate that out via this developer portal piece.
We've got some questions coming up now, and one is from Bex Lewis, and he's saying, I mean, you've been talking about how you, Hazel, how you develop the apps, how you look at their validity and reliability, how you set a framework. But Bex is talking about, how they're going to be used in the long run, in the role of the GP and the pharmacist in being involved in those apps and relating to young people as well. You know, he said he uses the Echo app, but he only wished that GPs knew about it and they were involved in it, and pharmacists as well. So have you done any work on that side of the integration of the, you know, the facilitator, the GP and the pharmacist and the young person who uses their app?
So at the stage that we're at with the programme, we've been mostly focused on what does trusted mean, and how can we introduce apps that are trusted via websites that are already used by patients and citizens. In terms of the commissioning of those apps, that sits really within the NHS England strategy and policy around that. So as well as there being a whole regulatory landscape around this, there's also the provision and commissioning of services. So at the moment we've got, the vision, I guess, is that apps that we include within the apps library will be the ones that are kind of got the stamp of approval to say, yeah, they're good to go. And then the AHSNs will step in to then introduce those apps into the commissioners across various areas. So, but in terms of ourselves kind of working with pharmacists and GPs to say you need to use those apps, that wouldn't come from our side of the world really. We're trying to enable access to those digital tools, but the commissioning side is driven from NHS England.
I mean, just before we go to Andy, who's going to take up Peter's point, Bex has come back and said the trouble is that GPs and so on don't usually know about apps. So maybe there's an awareness and education job to do as well.
Yeah, absolutely. And we've just had a lady join the NHS England team, actually, that's leading on digital strategy. And she comes from that environment. So she'll be putting together that strategy on behalf of NHS England to say, okay, because there'll be lots of policy implications, that kind of thing, that NHS England need to look at to say, okay, how do we drive uptake? What do we need to change? Do we need to look at indemnity policy and that kind of thing? And how, you know, what does that need to look like? So all that work's going on at the moment. But for us, our focus is, before we turn things from guidance into standards, let's build a mechanism so that the point in which it becomes a questionnaire, it goes from being a questionnaire into actually national standards. We need to provide that route through so that commissioners understand how to meet that standard, and then they've got a mechanism that they can send the developed apps that they want to commission within their area through to get assessed against that.
I was actually at Alderhay Children's Hospital last week, and it has a wonderful atrium, which is where people come and hang around before they have appointments and so on. And the idea of creating a physical app store within a space like that, where you could communicate the range of apps that are available and give people just some understanding about what's possible, would perhaps be an interesting thing to explore, especially because it sort of bridges that gap between everything being just digital and actual physical space, which I think people often would like some guidance. I remember Google set up its garages in different parts of the country a couple of years ago, where people could come in and just figure out how to even use their devices, which many people struggle with. So it's worth certainly thinking about that. But one of the questions we had from Peter was around the data. And I guess one of the challenges may be that in saying that this is a trusted app, you may be asked to comment on the data policies around the use of that app and how, in fact, some of that data is marketized and monetized by the developer. And I wonder what thoughts or conversations you have on that, or whether there may be something in the pipeline at all.
Well, so what we do cover, so we've just actually updated the current DAC to cover GDPR changes. And we do, so basically the way the DAC kind of works is that we look for an app to be conformant with any policy and legislation, and we look at things like privacy policy, etc. But in terms of use of data, as long as they seek consent and they're open about how data is used, that we leave that decision making down to the user. Mm-hmm. So again, we don't want to stifle innovation. We want to make sure that it fits with laws and regulations. So the DAC will align with the Data Protection Act 2018 when it comes in May. But the obligation is on the developer to prove, to evidence to us that they conform and meet those obligations, and then they can be included, as well as the other areas, of course, like clinical indicators, etc. But basically, we make sure that they conform and align with what's already out there. Once we start creating our own kind of regulations that sit outside of a legal framework, it becomes a different proposition. So our strategy has been to leverage regulation and legislation that already exists, make sure that an app conforms with that, and once they meet their obligations in that respect, then they're welcome to join us in the library.
I mean, we've talked about apps quite a bit, and obviously wearables is one part of your program, and I suppose they're often quite related, but I suppose another thing that strikes me is, would you, in your current role, envisage the NHS getting behind the design of some amazing wearable technology that could be what everybody uses in the future?
Absolutely. So yeah, it's funny. So to be honest, the reason I joined the NHS was because that's something I personally feel passionate about. The thing that led me to join the NHS was, sadly, I suffered a loss in the family, and it was a tragic loss that had been misdiagnosed for about 18 months, and that made me question whether there's something we can do that's to help the NHS, because obviously I'm very proud to work for the NHS, and I'm very proud to wear the lanyard it's one of the few companies I've worked for that I feel truly proud to be a part of it. And so I wanted to try and contribute in some way. And sadly, because we're quite a digital family, when we did discover an AI tool and put my uncle's symptoms in, it actually signposted the illness much quicker than the GP did. And had we trusted that at the time, I think we would have been braver in challenging the GP, and we didn't do that because we didn't feel confident to do that. And I think that's the piece that inspired me. And then when I think about things like, a friend of mine who I also lost to diabetes because she moved from animal insulin over to human insulin, had she had a wearable device that alerted her phone so that she had something to tell her that her blood sugars are going low. That's the kind of stuff where I think if we can do that, if we can deploy that kind of technology that people can choose to or choose not to use, but if we can give that choice, then that's a really powerful proposition. And it's as tough as it is working in the NHS, we're always overworked and lots to do. But the thing that keeps the team that I've got going is that kind of vision of, actually, if we could genuinely provide choice that can directly improve people's lives, then that's the value that we add. And I think wearables is a massive part of that. I think at the moment, some of the apps we've got on there that have got a different varying degrees of usefulness. I think the kind of the long-term end game are those type of wearable devices that add true meaning and truly lead to an intervention that improves a life in that way. So yes, in terms of where we are with wearables at the moment, though, we're a little bit of a way off that. I think there's a piece of work that we need to do around, again, at a policy and uptake level and at a commission level, to say, okay, how do we prioritise wearable devices? Is it a bring your own device? Is it something we pay for? And there's a whole strategy piece of work that's going on within NHS England at the moment, looking at pricing and the nuances that around pricing for apps and wearables, because it's slightly different to your technical traditional IT system. So we're not as far along that journey, to be honest, as I'd like to be for wearables, because we've kind of been testing out the whole variety of apps and stuff before we get to that point. But long term, absolutely, I think that's where the real value.
And on that, we've got a question from Michelle that's actually leads into a conversation I think we'd like to have about young people. She talks about Instagram and the concern that somehow health information can be simplified in a way that actually may undermine its integrity. And I wonder what you've experienced so far, how much of what you're doing is sort of appropriate or applicable to young people. I mean, we're looking at 13 to 18-year-olds, and I wonder what conversations you've had or how you would imagine those apps being of value to young people like that.
Well, so one of the tools that we've got in the apps library is one called Chat Health. And actually, that's not an app, that's a text service that was developed, I think, by Leicestershire Trust. And that's a texting service that, for me, is a perfect example of where digital technology is helpful to young people, because it enables young people to have a text-based conversation with a nurse about a concern that they have about a medical condition. It may be something that's embarrassing that you might not want to talk face to face. So I think there are definitely some digital technologies that lend themselves more to younger people in that respect. In terms of our user research, we've literally only just started that piece of work in the last 3 weeks. So when I shared some of the research that you guys have already carried out, Janet, our user researcher, was really excited about that, and she'll be following up with you after this. And I think we need to learn more about you. So the piece about YouTube is good. It's good to hear. It's kind of new to me and feels kind of obvious now that you've stated it. But it's that kind of information that we need to bring in. We're already working with Amazon Alexa and Google to find out how we can exploit their technologies. But definitely, I think there's learnings that we need to factor in, and we're taking a continuous approach to the way that we're developing. So we'll be having small releases that are refined based on what we learn from research and from user testing. But we probably haven't done enough in that area at the moment. So we'll probably want to leverage the work that you guys are doing so that we can factor that into our strategy and deliverables.
Yeah, Bex also asked a question about reliability. And I mean, you talked about how you set a framework standards. And this question is really, how do you make sure the apps work? Because you talked about blood pressure, lots of apps out there and they're not accurate. Do you actually investigate that and try to assess that they really work before you approve them?
So what we do is there's kind of this, I suppose there's 2 stages to what we do. So first there's a clinical evaluation stage in which we get clinical experts to play around with the app and say, do we think that this is a useful app, just on the, in terms of how does it feel to you as a clinical expert in your area? How does this feel? Does this feel like something that would be useful to you? After that, it then comes into a technical evaluation. So that's the piece. So if it's some kind of algorithm that would deem it as a device, then it's required to comply with SCI 0129, which is standard that asks that the right hazard logs and safety logs exist. And we also ask developers of those apps to provide evidence on what testing they've carried out to make sure that their apps can be trusted. And so yes, we carry out that piece. What we don't do is a full assurance. Unless it's connected into NHS systems. If it's connected into NHS systems, then it has to go through quite a rigorous assurance process. But as part of the technical assessment, we look at interoperability, we look at technical stability, we look at the safe encryption of data and all that kind of thing. And we will ask them to provide evidence of testing that they've carried out, functional and unit testing, to make sure that any functionality achieves the outcomes, the output that was predicted at the beginning of the test, if you understand what I mean.
Michelle Woods asked an interesting question that you may want to refer to as well, Andy. And she says, the relationship between patient and GP is often a power relationship. Are apps in any way changing that or reinforcing that?
Yeah, I mean, I think they absolutely are, and have for many years. I did an NHS event a few months ago, which was looking at how the doctor-patient relationship has changed in its depiction through film over the last 50 years. And it's clear that even the way in which we do documentary today is very different in conveying that relationship. I suppose the obvious answer is that it empowers people, but I guess what's happened over the more recent years, that there does seem to be more of a conversation between doctors and patients than there perhaps was in the past. I think it's typical scenarios, you sort of just accept what the doctor says and go along with it. But it seems now this is putting power into people's hands. At the same time, we're sort of anxious about the sort of ongoing literacy of people within digital environments, and not taking for granted the assumption that just because we've had digital for so long now, everyone's familiar with it and knows how to work it. And maybe Emma could come in here, because I think she's going to make some quotes from the data so far that tells us a bit about how perhaps young people are becoming empowered, but also the questions they have as well.
What you've just shared with us, Hazel, is I think really interesting in terms of some of the concerns that our young people have around what kinds of apps they might use. So if I could just go again, if I share my screen.
And while you're doing that, sorry, I've just spotted a comment about Google and Amazon, and somebody's put a question saying that we're working behind the scenes. So we're not working behind the scenes. What I meant when I was talking about Google and Amazon is looking at how users interact with Google and Amazon to understand. So the Amazon Alexa, for example, and people do use Google to search for specific health conditions. So it's trying to understand how users engage so that we can see what we can learn from that to input into where we where we kind of signpost users to apps. What's the right point in that journey of somebody from having a concern to then going out and finding information?
Okay, well, I think that's a really interesting point to pick up, because one of the tensions that the young people tell us that they're grappling with is both, you know, their interest in social media and a range of other technologies, but, you know, and I think a positive point for you here, Hazel, is they do rely on the NHS as a clear endorsement of credibility. So that's a really powerful signifier for them that it's a go-to, it's safe, and, you know, hearing from some of our young people around even things such as the NHS logo and what that means to them. So the security of knowing that, you know, and I think revealing some of the, you know, the processes that you've been through in terms of what does reliability mean, because when we've actually probed that with young people, well, why is the NHS a safe place? You know, what does reliability mean? There is a sense of not really knowing, and certainly some concerns around issues around privacy and data protection. You know, that tends to be left at the level of thinking about what it means to be online for young people in terms of what they're learning in school. So I think there is certainly a need in terms of literacy to understand some of those issues around where does my data go, who has access to it, what does that mean? But overwhelmingly, you know, we're hearing that the idea of having a recommended apps, a process at which is responsive as well. That's what came out from talking with them, that just having a suite of apps would not fit in with their everyday practices of how they use digital. You know, this idea of dipping in and dipping out was really important to them. So something that was quite responsive seemed, you know, really high on the priority list. But also this idea that, you know, going elsewhere to Amazon, Apple, they wanted something which was firstly, you know, safe in terms of the NHS endorsement, but also which relied on not just reliability and the sort of technical issues, but how is it being used by other people? So, you know, they talked at length about what their peers were using, what their friends were using, and how they heard, you know, through that kind of peer culture, what was a good thing or a good app to download. And so this idea of looking to other endorsements and other reviews was as important as, you know, that NHS endorsement. Other things, again, which I think you've already alluded to actually, but this idea of certain, you know, health conditions where the face-to-face became quite problematic, or the, you know, embarrassment around actually talking to somebody. So we spoke to them about Babylon and how useful would that be, and, you know, again, mixed, and I should sort of say as well that again, as you've pointed out at the start, because of the demographics, different experiences, different health needs or health priorities, engagement and responses to apps was pretty varied, but these are quite representative of some of the key themes that came through. So in terms of Babylon, this idea of, you know, talking through an app was seen as quite positive for some things and not for others. So that fear of, well, is this going to replace face-to-face contact is, I think, a myth that really needs to, you know, be dispelled amongst young people in particular. And of course, you know, it feeds into other anxieties more generally, doesn't it, about the role of technology in our lives and society. But the other thing that came out, and I think, you know, you've alluded to this idea of other parties, other stakeholders being involved in the process of understanding how we assess apps, but also how they're then used. So the uptake of apps, for example, within, you know, work placements, work schemes where they're monitoring the performance of workers, but also in terms of young people, that families or coaches or teachers might push those apps onto young people. So I think it's really important that, you know, those systems that are developed are working with the people who might be responsible for young people, and might use those apps to monitor or be pushed onto them. There's an issue of agency and choice around this. So I think this was an interesting example where a young boy who'd had some quite difficult experiences with his weight and being stigmatized and bullied around that, but also thinking through what might that app do to them in terms of their own background and experience of having their health monitored. So this was one example where, you know, he really spoke back and said, I wouldn't like that, and I've had a very negative experience of being monitored and assessed. So I think there are some issues around thinking about how those apps get used by others on young people, particularly, you know, if we're talking about how GPs might use them in place of other forms of therapy, for example. And I think you've spoken about this, but this need for the NHS to remain dynamic. Young people were very, you know, aware of that actually, you know, it is a dip in, dip out. They might use it for a few weeks. And I think it's an interesting quote, but again, these perceptions of technology as deterministic, and the need for them to be responsive in terms of individual health. And I think some of those perceptions of technology coming through again. And I thought this was interesting, this idea of, so I think there are lots of positive examples of the way in which tracking and monitoring can be used, but also some concerns that are being raised in some of the research at the moment around how tracking can be taken to quite extreme limits and can lead to quite disaffected health behaviours or relationships with our bodies in terms of monitoring what we eat and how much we run, how much we exercise, and there's, you know, all sorts of moralising going on within some of these technologies. So this was part of a focus group where young people were saying, well, actually what I think I might need is something that tells me where I'm going too far or to the extreme. So I think some of those issues around what's safe is also about how young people interpret data and what they do with it in terms of their everyday health behaviours. And I think for young people, this is an interesting one because they also spoke to us about the sort of competition amongst each other in terms of meeting those health ideals. And some of these apps are also coupled with what they're doing elsewhere online. So if they're looking at some of these images on Instagram, that in some instances are quite harmful actually, if we look at the body ideals that are presented through that imagery, then it's understanding how these technologies work, you know, in relation to each other as well. And again, this idea of the intended use of apps. And this was interesting, you know, talking a number of young people talking about how depression is becoming cool, you know, and the need to use these apps to actually have a category of disaffection or depression as giving them credibility amongst their peer groups. So how those self-diagnosis tools again might be used in unexpected ways, or perhaps ways that aren't intended, that are hard to capture when we, you know, look at what's recommended or what's safe. So I don't know if you've got any particular themes that you'd like to pick up from there, but those are some of the things that are really striking us in terms of what young people are telling us.
So I think from an apps and wearables perspective, so I think we're not changing behaviours that already exist in terms of, you know, people already choose to go and Google or use YouTube to find out more information about something that's concerning them. And I don't think we're trying to replace any of that. You know, we're not trying to promote that behaviour, but what we're trying to do is say that if we know that that's what's already happening out there, how can we put a safety wrapper around some of this so that actually we're providing somewhere to go? So obviously we've got NHS choices and the conditions pages that go through loads of governance. And from our perspective on the programme here, our clinical lead is a GP, practicing GP actually, and we've got lots of other clinical experts. And I think what our concern is that if there's 250,000 apps out there and there is nothing that's saying, well, actually, here's a safe alternative, then that's something we're not doing and we should be doing. So when one of the comments was about the NHS staying dynamic, I think the obvious options, and bearing in mind private sector have been through this whole kind of digital disruption albeit different business models. I think for us, all we want to do is create a kind of a safe means for people to say, well, I could choose one of these 250,000 apps, or I can stick with the NHS, knowing that the NHS would have carried out checks that Apple and Google don't and wouldn't have the expertise to carry out from a clinical perspective. So I think the behaviours in terms of this kind of self-diagnosis and I've been there myself, where I've Googled stuff and it's told me that, well, I've managed to get it down to a condition that is the extreme version of something that turned out to be some kind of flu or what have you. But so I think we've all probably done that, and I don't think we're not going to stop that, and we certainly don't want to replace any face-to-face activity. But we're just trying to recognise that there is pressure on the GPs at the moment. There are a lot of the consultations that go to GP tend to be advisory, in which in some cases leaflets or what have you are given out, and all we're trying to do is say, well, how can we use digital technology to make that a safer experience, to not replace, but just make it, give other digital options that replace the digital options that have not been through any kind of safety type assessment. So I think that's our key focus, and we have had we do get, luckily we do get a lot of support at the moment. I'm kind of waiting for the negatives, because you always have that balance, positive and negatives, and I'm hoping that we're thinking this through well enough, and that we're engaging enough of the right people to make sure that we're doing the thinking to say, well, what if, and that we're considering that in terms of the action that we're taking. But everything you've said in the feedback that you shared from the groups that you've spoken to absolutely resonates. And in some cases it's new kind of stuff that I'm hearing, and in other cases it sounds familiar with actually not just the youth but other users. And I should actually tell you that we've got another programme that's running within our kind of initiative that's called Widening Digital Participation. So that's a piece of work with Good Things Foundation that's looking at the edge groups in society that might not be a typical digital user, so that we can start to factor in the learnings that we get from that, to make sure we've considered that in our kind of strategy going forward.
Yeah. Well, I think one of the things about the recommended apps, again, overwhelmingly positive in terms of what young people were saying. But what's interesting is I think they're trying to find these checkpoints anyway. So the significance of others in terms of, I found this app or I have this piece of data, was really important in terms of, I speak to my mum, or I speak to my friends or my coach about how to make sense of this or what to choose. So I think there is a sense of they're already looking for, reliable sources to help them make decisions about what to use, but also what to then do with the data that is produced from their engagement with those technologies. So I think it's almost a sort of logical progression that they're saying that, yes, we need this, and it helps us navigate this 250,000. It's a huge landscape, and time and again we hear it's overwhelming. So yeah.
It's quite interesting. You mentioned doing some research, Hazel, on how different ages are impacted by apps and so on. And I noticed lots of the debate on the side is about their worry about Google, their worry about data. Sam Martin asks whether people can opt out, for example. It's quite interesting. And Andy, you might want to respond to this as well. Is that a concern of maybe, and I put myself in this category, older people, and that younger people don't worry about that? They don't mind sharing information. They're less concerned.
What I was thinking whilst reading those comments and just hearing Hazel speak a bit is, what I actually would like is for the NHS to benefit from the data insights that these apps are developing. And because to the extent that data is a determinative force, both economically, but also just in terms of understanding how insights can inform the development of healthcare, I wonder whether there is an aspiration to at least share the data that these apps are generating to provide a better healthcare service, or whether you just have to be pretty much hands off, because ultimately these are companies that need the data to make their money and to keep going.
So it's interesting. So I think the choice already exists. So if you were to go into an app store and choose an app, to download. As a user, you'll be making a decision as to whether you're comfortable in entering your information into that app. I think our approach has been firmly on, as long as if it conforms to legislation and it's and it meets those standards and requirements. I've just had a battery warning on my laptop. As long as it meets those meets that criteria, then we don't want to be too much of a kind of a we don't want to stifle things too much. We want people to have the choice. We just have to message in a very clear and transparent way to say, by using this, you're giving this information, you're consenting to this information. And actually that obligation as a developer of an app sits with the developer of that app to make that, especially especially after GDPR that's coming in May. So for us, I think our cut-off is to say it needs to conform with legislation. If it conforms with legislation, then that kind of ticks that box from our perspective.
Okay, well, we've come pretty well close to the end of what's been a really interesting.
I've only got 10% left on my battery.
Great timing.
You'll be surprised. We've lost several people in the webinars because their batteries have gone. But we haven't lost you yet. But anyhow, yeah, we've come to the end, and I was just going to say, thank you for everyone. But before we go, Andy, do you want to make a final comment?
Well, just to remind people, we're going to have another one of these in April, which we think is going to be focused around AI. And then we'll have our May event at the House of Commons, May the 16th. We're planning for that. So we'd love everyone to join us again next month. And thank you to Hazel for being here and for everyone for turning up for the webinar. And it's been a really fruitful conversation, I think.
Yeah, I mean, thank you, everyone. We didn't manage to get all the points. They were coming up quite fast at the end and quite lengthy too. Smaller essays were coming up on the side. So that's been great. Thank you all. And thank you, Andy, for helping to facilitate that and for the project that you and Emma are doing and for the work you're doing as well, Hazel. As I said, this will be recorded and should be available in the next couple of days. So thank you all for taking part. And we'll end this.
Thanks very much for inviting me.
Okay, well, thank you. And we'll end this webinar now.